It's a program that fills a critical gap in hospital care for people with developmental disabilities. Sunbeam's hospital care program is the first of its kind initiative, supports patients during hospital stays. With the season of giving upon us, Sunbeam is issuing an appeal for donations to support this important program.
Sunbeam has been in the local community for almost 70 years in the Waterloo region. We do provide services across Waterloo, Wellington, Dufferin, Halton, and Peel.
Sunbeam's hospital care program is completely funded by donations.
And the idea is that when individuals in our inclusive living group homes might have to go to hospital, whether for an emergency or whether for a planned stay or a procedure, we try our hardest to have Sunbeam staff accompany them to the hospital and while they are in hospital. And that's so important because we support some of the most complex people around in some of our inclusive living group homes. And our staff being there are always staff who know the individual. They work with them in their home environment. They understand how they communicate. Some of the people we support do not communicate with words. Hospitals, they serve a very important function and they do it well, but they aren't staffed, they aren't resourced, and they aren't trained to sort of work with some of the special populations that we support here at Sunbeam. Families, of course, are often part of the hospital visits, but families can get burnt out, especially if the hospital visit goes on for days. We will purposely try to make sure that when the family can't be there, we will try our hardest to have Sunbeam staff there so the person is never left alone.
Tom and Karen Ludwig's daughter Sammy lives full-time at the Zeller House. Sammy is nonverbal.
Years ago, Karen and I were insistent on being with Sammy in the room 24 hours. So I'd go do my bus run, Karen would be there in the day, and then when I was finished, I would come and relieve her, and she could get home and get a shower and get some rest.
And then I would go back later because he had to sleep because he had to work in the morning.
Because the hospitals just weren't set up to deal with somebody of Sammy's nature, because Sammy can't fend for herself. She cannot protect her personal space if somebody were to enter that.
And she's not verbal, so she needs somebody who knows her, who can understand what the situation is, and then having known her situation and her personal history, can relate with the nurses and the doctors and just give them a good background on, Sammy as a person.
It's such a great program that the Sunbeam Home System brings to the community. You're not left with any worries. How is my child doing?
They keep in touch all the time.
You have to be the advocate if something's not working. You gotta reach out, and we've done that.
Families in general get worn down because that's a big job, 24-hour care. We still, as I had said, stay totally involved in her medical, and so having backup from the Sunbeam Center and the particular homes, the staff that came in, they know her, and it's so relieving. It's not just the stress of being there, but it's the stress of worrying if you're not there.
Having the services of the Sunbeam Group Home System just helps to maintain your mental health.